should I refer my employees into occupational health?
There are a number of reasons why you might want to refer someone into occupational health. You could be concerned about someone's attendance at work. They might be having persistent short-term absences, and you want to understand if there's an underlying medical condition that's affecting that attendance. There could be concerns raised about someone's change in behaviour or performance at work. So again, you'd want to understand if there was anything underlying that is contributing to that. You could be concerned about a medical condition that you just need to understand more information about and get an understanding of how best to support that individual back into work with regards to their return to work.
If somebody is off sick, at which point should I refer them into occupational health?
The earliest that you can refer someone into occupational health, the better. It's mainly around getting appropriate support and early intervention for certain conditions. They are predominantly musculoskeletal conditions or mental health issues, where evidence has shown that the earliest you can get intervention, the more likely they are to be able to recover quickly.
Should I tell the individual that they're going to receive a call from OH and explain the process to them?
Absolutely, you should be discussing with the individual when you're thinking of referring someone into occupational health. You need to give them an understanding of why you're referring that individual and how you're looking to support them back into work. You also should be giving them a copy of the Occupational Health Service Employee Guide so that they can understand what to expect from their referral. And you should be seeking their consent to actually action the referral. Once you've got the 3 elements in place, then you should be making the referral online.
Is there anything I should put into the referral?
Obviously, the more information that you can put in the referral gives a bigger picture to the occupational health advisor. So you should be looking at what your reasons for referral are. If you've already tried any return to work programmes or adjustments or support that you've already tried to put in place, whether that's worked or not, so that the individual can see what you've already tried so that they don't duplicate anything. You should be looking to put any sort of sickness absence statistics in there for however length of period that you feel is relevant, and any sort of other background information that you've got on the individual. But you do need to make sure that it's factual and that it's not got any sort of personal traits in there, because the employee can see that referral at any point in time.
How soon should I receive the report?
The report is normally available within 2 to 5 working days. The exception to that would be if the employee has sought prior viewing. The employee is given a choice of 4 options for consent when they're in the consultation. The first option is that they can release without seeing the report. They can then either have a copy of the report at the same time as it's being released to yourself, or they can ask for prior viewing, and prior viewing would then allow them to make any factual changes that they felt was relevant to, could be a date or a condition. What they're not able to do is change the opinion of that OH advisor. And the 4th option would be they have the ability to withdraw consent if they wish to, but we do advise against that because the report is in their own best interest to help support them in work.